Hi, my name is Deepti and today we will be learning about the topic the energy nutrients. We shall continue with the topic of minerals. The next mineral is potassium. Potassium is a mineral that is involved in both electrical and cellular functions in the body. Functions of potassium. Potassium is a very important mineral to the human body. It has various roles in the metabolism and body functions. It assists in the regulation of the acid-base balance and water balance in the body and the body tissues. It assists in protein synthesis from amino acids and in carbohydrate metabolism. It is necessary for the building of muscle and for the normal body growth. It is needed for the proper functioning of nerve cells in the brain and throughout the body. Quick facts. A diet low in potassium and high in sodium may be one of the factors that leads to high blood pressure. Eating equal amounts of sodium and potassium is recommended. Athletes involved in hard exercise may require larger quantities of potassium-rich foods. Potassium is found in meats, milk, fruits and vegetables. Role in health. Many people know that high sodium intake may lead to hypertension. Approximately 10% of people with high blood pressure are sensitive to dietary salt or sodium. A reduction in sodium level helps lower blood pressure in all people with hypertension. Newer evidence suggests that dietary potassium may play a role in decreasing blood pressure. Potassium is involved in nerve function, muscle control and blood pressure. A diet low in potassium and high in sodium may be a factor in high blood pressure. Increasing potassium in the diet may protect against hypertension in people who are sensitive to high levels of sodium. For people who have hypertension, following an overall eating plan called DASH, that is dietary approaches to stop hypertension, may be useful for lowering blood pressure. However, taking potassium supplements is generally not recommended for people with high blood pressure. Instead, a variety of potassium-rich foods should be eaten daily. Athletes also may need more potassium to replace that lost from muscle during exercise and the smaller amount lost in sweat. Now, sources of potassium. Good sources of potassium includes fish such as salmon, flounder, cod and sardines, meat such as beef and chicken, peas, lima beans, tomatoes, potatoes, especially their skins, leafy green vegetables, citrus fruits, bananas, apricots, melon, dry fruits, nuts, chocolates. Now, recommended dietary allowances of potassium. The recommended daily potassium intake is 4.7 grams a day. Athletes involved in prolonged hard exercise may require more potassium in a day. Deficiency of potassium. Potassium deficiency is not common but may result from excessive losses due to severe diarrhea, poor diabetic control, low calorie diets that is less than 800 calories per day, chronic alcoholism, hard exercise or some diuretics and laxatives. People with chronic diseases or seniors may experience hypokalemia or potassium deficiency. Potassium depletion may also be caused by vomiting, diarrhea or use of diuretic or cortisone medications. Symptoms of potassium deficiency includes fatigue, slow reflexes, muscle weakness and dry skin. If potassium levels are depleted quickly, a person could experience heart problems. If potassium levels are not replenished quickly, a person could suffer heart failure and even death. Toxicity of potassium. Too much potassium can lead to hyperkalemia or increased potassium levels in the blood. People with kidney problems or severe infection may suffer from increased potassium levels. The next mineral is zinc. Functions of zinc are 1. It is essential for spermatogenesis, that is sperm formation and normal testicular function. 2. Enhancement of the action of follicle stimulating hormone and luteinizing hormones. 3. Contributing factor in the stabilization of membrane structure. 4. Mobilization of vitamin A from liver to maintain normal concentration in the blood circulation. 5. Zinc plays an important role in the synthesis of DNA, RNA and proteins. 6. Zinc plays an important role in the sensory systems that controls food intake. 7. Zinc is essential for all living organisms for various functions such as zinc hydrogenase acts as a catalyst, helps in interconversions of lactic acid and pyruvic acid in the glycolytic pathway. Peptidase and aminopeptidase, this is involved in the digestion of protein. Phosphatase, this is required in bone metabolism. Ethanol dehydrogenase in liver, which oxidizes not only ethanol but other primary and secondary alcohols as well, including methanol and ethylene glycol, which serves as a major defense mechanism. Zinc interacts with insulin in the pancreas, serving as a storage form of the hormone. It is also involved in the functioning of hemoglobin. Now we'll study about sources of zinc. Rich sources includes liver, oysters, high protein food and whole grain cereals. Beef, lamb and pork contains 3 to 4 times zinc as compared to fish. Dark meat and chicken furnish about 3 times more of zinc as compared to light meat. Legumes, peanuts are good sources of zinc as compared to fruits and vegetables. Thus, zinc in plant proteins is less available than that of animal proteins. Now, recommended dietary allowances of zinc. Adult male 12 milligrams per day, adult woman 10 milligrams per day, pregnant and lactating woman 12 milligrams per day. Now we'll go over to deficiency of zinc. Zinc is important during the periods of rapid tissue growth such as childhood and adolescence. Retarded growth, that is dwarfism, and retarded sexual maturation, especially in males, are some of the important symptoms of deficiency. There is also impaired taste and smell, and if improved if the dietary intake is increased. Zinc deficiency also causes poor wound healing, hair loss, diarrhea and skin irritation. Toxicity of zinc. Prolonged supplementation of zinc can cause nausea, vomiting and decreased immune function. Excess zinc inhibits the absorption of copper, thus resulting to copper deficiency. The next mineral is selenium. It is present in all body tissues. The highest concentration of selenium appears in the liver, kidney, heart and spleen. Now we'll study about functions of selenium. It is an antioxidant which protects the cells and the lipid matrix from oxidative damage. An absence of selenium can help spare the use of vitamin E because they both protect against free radical damage. Selenium helps in the regulation of thyroid hormone. Now over to sources of selenium. The amount of selenium in foods is dependent upon the quantity present in the soil. Seafood, kidney and liver are good sources. Recommended dietary allowances of selenium: 55 grams per day for adult male and females. Deficiency of selenium. Mild deficiency can hamper the immune system. Such individuals having deficiency of selenium are at a risk of cancer. Toxicity of selenium. Most important symptoms include bitterness in hair and nails. Other symptoms include skin rashes, giddiness and nervous system abnormalities. Now the next mineral is fluorine. Functions. 1. It includes prevention of dental caries and protection of bones from osteoporosis. 2. Fluoridation of water and addition of fluorine in toothpaste have decreased the incidence of dental caries. Fluorine is responsible for giving bone its density. Now we'll study about factors affecting the availability of fluorine. Fluoridated water is the best source of this mineral because it provides a more bioavailable source of the mineral than the protein-bound form found in foods. Now, sources of fluorine. 1. It includes fluoridated drinking water. seafood and black tea. Second, fish such as salmon, halibut are good sources of fluorine. Symptoms includes growth retardation and dental caries, anemia, weakened bones. Toxicity of fluorine. Chronic dental fluorosis results when the concentration of fluorine in drinking water is in excess of 2.5 ppm, that is particles per million. The teeth become mottled, that is the tooth enamel becomes dull and unglazed and with some pitting. Now the next mineral is iron. Iron is an essential component of hemoglobin, the oxygen carrying pigment in the blood. Iron is normally obtained through the food in the diet. Iron is part of hemoglobin, the oxygen carrying component of the blood. Iron deficient people are tired easily because their bodies are starved for oxygen. Iron is also part of myoglobin. Myoglobin helps muscle cells stores oxygen. Now we'll go over to functions of iron. 1. Hemoglobin synthesis. In most of the bodies, 70% of iron occurs in RBCs. Iron is an essential component of heme, the non-protein part of hemoglobin structure. Hemoglobin and RBCs carry oxygen to the cells for oxidation and metabolism. Iron is also necessary for myoglobin, the compound present in muscle tissues. 2. General metabolism. Iron is necessary for proper glucose metabolism in the cells, antibody production, drug detoxification in the liver, collagen and purine synthesis, and conversion of carotene to vitamin A. Now we'll study about types of iron. Iron absorption depends upon its sources. Iron occurs in two forms in the food, namely, one is heme iron. Heme iron is found in only foods derived from the flesh of the animals such as meat, poultry and fish. Second is non-heme iron. This is found in both plant-derived and animal-derived foods. Iron from animal sources is easily absorbed and about 25% of heme iron comes from these foods. On the other hand, only 10% of non-heme iron is absorbed depending upon the dietary factors and body's iron stores. Most of the body's iron is found in two proteins, hemoglobin in RBCs and myoglobin in muscle cells. Hemoglobin. Hemoglobin is the oxygen carrying protein of the RBCs. It transports oxygen from the lungs to the tissues throughout the body and accounts for 80% of the body's iron. Heme is the holding part of both hemoglobin and myoglobin proteins. About 40% of iron in meat, fish and poultry is bound to heme. The other 60% is non-heme. Iron has two ionic states in the body. Reduced state known as ferrous iron, oxidized state known as ferric iron. As it can exist in different ionic states, iron can serve as a cofactor to enzymes involved in the oxidation reduction reactions. Iron therefore helps the body to make full use of its oxygen, both transporting it to wherever it is needed and then ensuring that it is properly utilized. Now we will study about factors affecting the availability of iron. 1. In general, the bioavailability of iron in meat, fish and poultry is high. 2. In grains and legumes, it's intermediate and in most vegetables low, especially those high in oxalates. 3. Foods that contain vitamin C assist in the absorption of iron. For example, a glass of orange juice will aid in the absorption of iron from the boiled eggs, meat, poultry and fish. 4. Oxalates and phytates. Green leafy vegetables inhibit the absorption of minerals. Now we'll study about sources of iron. Rich sources of iron are cereals, millets, pulses, green leafy vegetables, cereal grain and millets, bajra and ragi. Milk is a poor source of iron. Recommended dietary allowances or the RDA of iron. The recommended intakes are based on iron absorption by 3% in adult men, adolescent boys and children, 5% in adult women, adolescent girls lactating women and 8% in pregnant women. According to ICMR 2010, requirements are adult men 17 milligrams per day, adult women 21 milligrams per day, Pregnant women 35 milligrams per day, lactating women 21 milligrams per day. High risk groups for iron deficiency: women of childbearing age who have blood loss through menstruation, pregnant or lactating women who have an increased requirement for iron, infants, children, adolescents in rapid growth phases, and people with a poor dietary intake of iron through a diet of little or no meat or eggs for several years. Risk factors related to blood loss are peptic ulcer disease, long-term aspirin use, or colon cancer. Vegetarians are at risk of developing anemia. This usually occurs because they don't eat meat, especially red meat, which is high in iron. However, vegetarians don't always develop anemia. There are many vegetables that contain iron, such as broccoli and spinach. Now we'll study about deficiency of iron. 1. Iron deficiency anemia is a condition where a person has inadequate amounts of iron to meet body demands. It is a decrease in the amount of red cells in the blood caused by having too little iron. Iron deficiency anemia is the most common form of anemia. 2. Some people with iron deficiency anemia always feel cold. They feel cold because iron plays a role in regulating the body's temperature. 3. Individual with iron deficiency anemia may also experience pica, an eating disorder characterized by persistent and compulsive cravings to eat non-food items. Iron imbalance involving excess rather than deficiency occurs in hemosiderosis and hemochromatosis, the two disorders of iron metabolism in which there are large deposits of iron in the liver, pancreas, and other organs. Hemosiderosis. The term hemosiderosis is reserved for excess of iron stores without tissue damage. In hemosiderosis, there is abnormal distribution of RBCs as in hemolytic anemia. It may also occur due to prolonged iron therapy when it is not needed. Hemochromatosis. In hemochromatosis, the excess iron produces complications such as cirrhosis of liver or diabetes. One form of hemochromatosis appears to be a disorder in which iron is absorbed much more efficiently than normal. Now we'll study about causes of anemia. Anemia may be caused due to several factors as blood loss, bone marrow failure, destruction of RBCs, deficiency of nutrition that plays an important role in hemoglobin and RBC synthesis, lack of gastric hydrochloride necessary to liberate iron for absorption, presence of various inhibitors of iron absorption, mental hemorrhage, chronic diseases such as TB, ulcers or intestinal disorders, excessive menstrual losses, excessive blood donation, parasite infections such as hookworm, etc., deficiency of iron in diet during period of accelerated growth such as infancy, rapidly expanding blood volume. Now we will study about symptoms and treatments of anemia. When anemia becomes more severe, the symptoms are more consistent. Symptoms include weakness, fatigue, headache, sensitivity to cold, decreased physical work capacity, paresthesia, chillosis, glossitis, loss of appetite, and decreased gastrointestinal tone, concave nails, oxygenation of tissues is reduced, thereby feeling of fatigue, increased heart rate, shortness of breath. Now we'll talk about treatment of anemia. Oral therapy is very effective as compared to parenteral therapy, except where there is a severe interference with absorption as in ulceration, that is ulcerated colitis. Some individuals have GI intolerance to iron salts but usually become adjusted to the medication. That's all from this topic. Thank you for being part of VLCC Institute.